And President William Ruto has signed into law 4 bills that will see radical changes to the country's healthcare system. The head of state, who leads yet another attempt towards universal healthcare following 2 previous failed attempts, touted the new laws as a springboard for Kenyans to access affordable and quality healthcare, as Ayub Abdikadio now reports.
The head of state, fresh from a visit to China, put pen to 4 bills passed by the bicameral parliament. First to be signed into law were the Primary Healthcare Bill 2023 and the Facilities Improvement Financing Bill 2023, passed by the Senate, that is set to lay a foundation for primary health and upscale the state of health infrastructure. President Ruto next signed the Digital Health Bill 2023 and the Social Health Insurance Bill 2023, which he touted as a consequential step in Kenya's journey to universal health coverage. And with the government saying the new laws will make healthcare more affordable and accessible, many Kenyans, especially the employed, see the signing of the bills into law as a new tax amid the rising cost of living.
Today, 4 crucial bills for the implementation of universal healthcare have become law. These laws, together with various policies, strategies, and regulations that will be subsequently implemented, including the community health policy and primary health care and health financing strategies, will lay the firm foundation for the biggest change in our healthcare system ever witnessed.
Currently, Kenyans pay between 500 and 1,700 Kenya shillings monthly contribution to the National Health Insurance Fund (NHIF) that will be replaced by the Social Health Authority, with the minimum contribution set to reduce. But for salaried workers, the amount will depend on one's salary, with the Health Cabinet Secretary expected to present draft regulations to guide on the rate of deductions. The President says the government will help Kenyans who cannot contribute towards the fund.
Many Kenyans have asked me often, okay, we want to reduce from 500 to 300. Many Kenyans have asked me, what happens to the person who cannot afford 300? I want to say, under the laws we have passed, even those who cannot afford 300 will now have an opportunity to have an insurance cover, so that we can truly say no Kenyan will be left behind.
And despite the head of state and the Ministry of Health officials remaining upbeat about the new laws in improving the quality of healthcare, the Council of Governors expressed concern over 2 of the laws, the Social Health Insurance Act and the Facilities Improvement Financing Act.
The other 2 bills, we will not say exactly we have issues. We only ask that in the state they are in at the moment, they may not be implementable, but the solution would be to have regulations made in the shortest time possible so that we can make them implementable.
Health CS Susan Nahumicha hailed the 4 new laws, terming them as a cornerstone in changing the country's healthcare system.
Now we are clear on what is the benefit as soon as you make your payment. What is it that you are entitled to? Your Excellency, we have removed exclusions. We have removed limitations that now Kenyans will be able to access services and we shall not be able to leave anyone behind.
The presidential assent to the laws comes ahead of the universal health coverage launch in Kericho County on Friday during the Mashujaa Day celebrations, during which also the National Community Health Promoters Program will be rolled out by the President. A step in a direction he pledged in the plan. And in acknowledging how long and painful this path has been, President William Ruto leads Kenya on yet another attempt to attain universal health status. He, however, comes against a pathway replete with concerns over the quality of care, sloppy human resource, and wanting state of health infrastructure across the country. Ayub Abdikadir, Citizen TV,